Acidosis is when your body fluids contain too much acid. Acidosis occurs when the kidneys and lungs can't keep the body's pH in balance. Metabolic acidosis occurs when the kidneys either get rid of too much base or are unable to eliminate enough acid. Some risk factors associated with metabolic acidosis include a high-fat diet low in carbs, kidney failure, obesity, dehydration, or diabetes. Symptoms of metabolic acidosis include rapid breathing, confusion, fatigue, headache, sleepiness, and an increased heart rate.
Respiratory acidosis occurs when too much carbon dioxide builds up in the body. Normally, the lungs remove CO2 while you breathe, but sometimes your body can't get rid of enough CO2. This can happen because of chronic airway conditions such as asthma, injury to the chest, obesity, which can make breathing difficult, overuse of alcohol, or deformed chest structure.
Hey, Melanie? Melanie?
Whoa! What? Where am I?
Well, you're at Mayo Clinic. You see my badge?
Oh, that's right. I decided to go to the doctor.
Yeah. Are you okay? What seems to be the problem?
I don't know. I'm really short of breath, and I have a raging headache. And I'm confused and tired. I'm always falling asleep no matter how much coffee I'm drinking.
Okay, well, it seems to me like you have a type of acidosis. Let's get a sample of your blood pH, and we can determine if that's really the case and which type of acidosis you have. So, I'll be right back.
Sounds good.
Hi, Melanie. I'm back with your test results. So what we did was we took a sample of your blood and determined the pH of it, and it looks like you have a pH of below 7.35, and the normal is 7.4. And I see on your medical records that you have asthma, is that correct?
Yes.
Alright, well, knowing your symptoms and knowing that you have asthma as well, it's safe to conclude that you have respiratory acidosis.
What's respiratory acidosis?
Well, respiratory acidosis is when your lungs can't get rid of enough carbon dioxide that the body produces. And when you have excess carbon dioxide, this lowers the pH of your blood, making it more acidic.
Wow. So what's the next step? How do we get rid
Well,
of this?
luckily we do have some treatments, so I'll go get them for you and explain them to you.
Okay, awesome.
Okay, so some treatments we have for respiratory acidosis are sodium citrate and baking soda, and both of these raise the pH of your blood back up. And we also have bronchodilators, and these dilate your bronchioles, which opens up the airways a little bit more. And I can also give you a continuous positive airway pressure device, also known as a CPAP device, and this helps someone with obstructed airways breathe better. But I'll get you started on bronchodilators and baking soda, and we'll see where that takes you. There are a few organs in the human body that are affected by acidosis. One organ is the heart. When an influx of hydrogen ions occurs, this can cause reduced contractility or contractile failure of the heart. High amounts of hydrogen ions in the intracellular fluid interferes with the calcium current necessary for myosin and actin filaments to bind. Severe acidosis can also cause tissue necrosis or death to the myocardium, which is the muscular tissue of the heart. Acidosis impairs the lungs' ability to remove carbon dioxide, which causes hyperventilation. And hyperventilation occurs when the rate and quantity of alveolar ventilation of carbon dioxide exceeds the body's production of CO2. Respiratory acidosis can be caused by diseases affecting the nerves and the muscles that signal the lungs to inflate or deflate.
Acidosis affects the central nervous system by increasing cerebral blood flow and intracranial pressure. This causes a depression and malfunction in the central nervous system, and if untreated, can lead the individual to become comatose, which means the person is unconscious. Acidosis affects the circulatory system by causing an overactivity of the sympathetic nervous system. This causes vasoconstriction of pulmonary arteries, peripheral veins, and vasodilation of peripheral arterioles.